Hi, I'm Dr. Alan Lifton. This is Brainsplained, and today I'm brainsplaining some wrong thoughts that are related to people's prejudices. If we put chemicals in your body, and if chemicals going into your body can have a chemical reaction and cause changes to occur, biochemical changes to occur in your body, then it's true that we can alter the processes that are happening. We can alter biochemical processes in your body and have an impact on its function. And we can. That's true. Okay? So some people think that if they go to a store where there is a green sign on the front of the store and they get some chemicals and stick them in their body, they're certainly not going to cause them harm. If they go to a store and it has a red sign on the front and they get chemicals and stick them in their body, they're almost certainly going to be harmed. This is basically how they're thinking. Okay? So I'm talking about the people who think it's perfectly okay for them to take nutritional supplements and vitamins, which are chemicals, okay, that have a biochemical effect on your body. But then they turn around and they're afraid to take medications. And by the way, the people who take medications and are afraid to take supplements and other things like vitamins, they're the opposite thought process, equally wrong. There are some issues that are related to quality control in some of the vitamins and supplements that sometimes need a little bit of creativity to overcome. But the basic problem that I have with the thought process is that people aren't realizing how arbitrary this is. It's pretty dangerous to take peyote. It's a chemical that comes off of a cactus plant. Doesn't need to be purified. And it's as dangerous as just about any of the medications we use. Maybe not all of them, but it's a serious chemical. And the same is true for psilocybin, which is the compound that's in psychedelic mushrooms. It's a relatively serious risk. Just because it's natural doesn't mean it's guaranteed safe. And just because it's pharmaceutical doesn't mean it's guaranteed safe or guaranteed dangerous. Okay, it's the exact same thing. You're taking chemicals and you're sticking them in your body and changing the biochemical processes. Sometimes there are physicians that unfortunately think very poorly about the option of treating things more naturally. It has to be a pharmaceutical compound. That's a little arbitrary because putting chemicals in your body is putting chemicals in your body. Sometimes some of the science is well worked out, and sometimes some of the science is not well worked out. And sometimes that's true for pharmaceutical compounds. So when I look up all these anti-epilepsy drugs and try to figure out why do they stop seizures, very often it says, well, the mechanism for anti-epileptic action is unknown. It may be that it works and we don't know why it works. And that's very similar to a lot of the issues related to plant medicine. But I run into a lot of that prejudice, and I just wanted to clarify that it's a little silly. And I hope that's Brainsplained.